Welcome back, everyone. Dr. Rhonda Medina is with us today. She's an obstetrician and gynecologist with Lima Memorial Alliance OBGYN. Talking a little bit about hysterectomies today and also some alternatives for women out there. If you could tell us first what a hysterectomy is.
So a hysterectomy is actually removal of the uterus, which is one organ, which includes also the cervix. Sometimes we leave the cervix, sometimes we don't. A lot of people think that a hysterectomy involves removing the ovaries as well, but that's not always the case. That procedure is called an oophorectomy. So when we just say the word hysterectomy, it's removal of the uterus only.
When we think of that procedure, are there other surgical alternatives then for a hysterectomy?
So with a hysterectomy, or for reasons for a hysterectomy, it can be bleeding problems, it could be pain, it could be fibroids. There's a lot of different causes that can lead to a hysterectomy. There are alternatives to take care of the symptomatology, like bleeding. There's minor surgeries. If it's for bleeding, it can be more minor surgeries called an ablation. There can be medicine that can take care of abnormal bleeding, birth control pills, hormonal therapy. There's also like just oral medications that are not hormonal that can be taken just during the abnormal bleeding period. So there are alternatives.
I think patients worry so much about the recovery and how that looks and the recovery time, but it sounds like especially if it's a medicinal option, there are different kind of rates of recovery and what you might experience.
Yes, so if we can control people's symptoms with medicine, we always try that first. But with an ablation, which is a minor surgery, just burning the lining of the uterus, that's like a 2 to 4 day recovery time, as opposed to with a hysterectomy. There's different types of hysterectomies. Like I was saying, there's laparoscopic, where we go through the belly button and use cameras and we remove the uterus that way. If that is the case, then it's only a 4-week recovery time. If it's an abdominal hysterectomy, that can be up to 8 to 10 weeks off.
You mentioned some of the symptoms. Remind us again certain things maybe we should look for if a consultation might be appropriate to talk about a hysterectomy.
So most people come to the gynecologist for bleeding problems or for pain. With pain, it's a whole different workup that you have to do, because sometimes even removing the uterus doesn't take care of the pain because of all the nerve connections and it could be the bladder, it could be bowel. So the workup is a lot more extensive. For bleeding problems, it could be medical, like thyroid problems. So we always do a workup for a thyroid problem or a bleeding disorder. So yeah, it depends on what you're doing the hysterectomy for.
Okay, and if folks need more information, then call 998-8245 or talk with you, maybe set up an appointment. Dr. Medina, thank you so much for the information.
Yeah, thank you.
Nice talking with you. We'll be back after this.